all these modules are freely available. Plus, we have HA Kerala has a Facebook page where you can see all the articles, all the recordings of the webinars which we have done so far. So please do visit HA Kerala's Facebook page as well. So with that, I'll now move on to the responsibility that has been bestowed on me. At the outset, let me first welcome Dr. Riyaz, the Honorable President, IAP Kerala. Happy to have you here, sir. Next, the most respected MKC sir is here. Sir is was the past National President IAP, so was the past Vice Chancellor Kuhas, and he's the expert on the subject. Extremely happy to have you here, sir. And we also have Dr. Jose sir, Nandakumar sir, Purushothaman sir, Parvati ma'am, and many seniors over here. I welcome all of you here and all the dignitaries and office bearers. Please, you're most welcome to this webinar. Thank you.
Thank you, ma'am. For the presidential address, now I invite Kerala State President, Dr. Riyaz, sir, for the presidential address.
Thank you, Dr. Vidhu. So, respected chief guest of the day, our own MKC sir, the past president, Dr. Jose sir, Dr. Nandakumar, Anandakrishan sir is here. Welcome, sir. Then Purushothaman sir, Parvati madam, the office bearers of AHA, Dr. Deepa, Vidhu, and my own team members, Dr. Gopi, Dr. Ranjit, and all the seniors and friends here. So, in the recent times, we have noticed that there is an unprecedented increase in the violence involving children, both occurring to the children and also children and young adults are increasingly getting involved in many violent incidents in our state. And along with that, we have seen that there is an increase in this capture of substances and all those things. And we are actually having an impression that there is an increase in mental health issues among our children of all age groups and adolescents as well as young adults. So IAP Kerala is actually starting a humble campaign to do something on this. This is the very first among them. We actually had a brainstorming session with the people who are working in this field, both from IAP and outside IAP, with MKSSR as chair. And we have actually charted out a plan to do something on that, so that pediatricians and teachers will be equipped to find out children who are having mental health issues early in their life and do help them. So this is again one such attempt, because we once in a while we see that children getting broken down with the exam stress, children going for self-harm attempts after the results are out or after the exam being very stressful or difficult. So I think this webinar will also be uploaded in our YouTube channel, so that our members can see it again and equip themselves to help children as well as parents, because parents are also at stress during the exam time. So I profusely thank the team for this effort. Can you unmute everyone? Ranjit? Okay. Yes. Okay, then when MKSSR asked us to conduct a session on exam stress at a very short period, then Dr. Deepa volunteered that you already have a module and now you are ready with it. So I wish we will have a very fruitful session today. And also I am very happy that MKC sir is here, because I would like sir to speak not only about exam stress, also about this rising violence among children and his words of wisdom on how to tackle that. Thank you. best wishes for the program.
Thank you, sir. To invite, I'm actually honored to invite our guest of honor, who does not need an introduction at all, Dr. MKC Nair, sir. Sir is the director in Spectrum CDRC. Sir was also the former vice chancellor of COHAS. Sir was also our national president. Sir, now we invite you to speak, sir.
So good evening, everybody. Dr. Riaz, Honorable President of the Academy, all the senior members. Actually, this was last time when we were brainstorming. The idea came, we should do something. But to do something, most of the time, we waste a lot of time trying to plan, get everybody into the board, etc. So I only suggested that let's start doing something. And the doing something, immediate priority is exam fear. Because many children are already into the exam, many are going to go to the exam, and the process of entrance, which is the most traumatic event, it is going to take place in another 1 or 2 months. So reaching out to parents, reaching out to children, the best thing is exam fear. And then, of course, Madam suggested, AHA Secretary suggested that they have a module. I said, do it quickly now. Don't worry about the quality of the module. Don't discuss, oh, it is missing this, it is having that. Forget about all this. Let us do something where each one of us can participate. That's the idea it came. Now, when you look at exam fear, we actually generally we say it is because of problems in the school, problems in the family. It has something to do with the capacity of the child. It also intellectual capacity. It also has something to do with the learning disabilities, all that. But having said all that, what is the most important one is the mental health issues, which doesn't mean not serious psychiatric problem, but mostly is anxiety in different forms. And anxiety, exam fear is one of the anxiety. So I was just quickly today looking up what all can be done, because we have done a lot of work even in the university regarding, study problems and all that. What we realized at that time was there is a systematic way of doing it. But then now we have no time to go about systematically. So when the university, we had student guidance and support program where it was done very systematically. 2 teachers trained from every college, having every monthly program for them. The vice chancellor himself going to each district every month, wherever possible, not every district, but wherever possible. So that sort of thing, it cannot be done in this day. Now the plan we have is just like the UNICEF supported program we did in the for behavior problems in children, all the time of COVID. We did a quick survey and all that, something like that. Rapid survey, rapid action has been done. Now, what are the things that we have to do? Definitely, we need to identify the behavior problems in children. We are working towards that. We had already had a preliminary discussion with all experts. Now, we have got a draft, questionnaire designed, simple, so simple checklist sort of. And maybe next meeting Riaz is arranging, we will discuss those things and then come out with an action plan within a week or 2, because we can't wait anymore. But right now, our priority is examination fear, and let's get on with it. And my best wishes, and I'm sure we will do well. The module is so simple that everybody can participate. You don't have to be a child psychiatrist or psychologist to participate. Our simple pediatric Nelson experience is more than enough to do this work. So thank you so much.
Thank you, sir. Now for the felicitation, I invite Nandakumar, sir, President-elect.
Respected President IAP Kerala, Dr. Riaz, and most respected MKC, sir, other dignitaries on this platform. As Dr. Riaz already explained, we were discussing about how to handle or how to contribute to the so many unwanted and unfortunate news are coming nowadays in papers. And so we thought, as a pediatric association, we should involve and we have to do something to solve or something, suggestions or something you have to do as a as we are dealing with those children. So we were discussing with so many experts, including our own doyen, Dr. M.K.C. sir, and sir only suggested we'll start with this exam fear. So what we are planning, my next term is my term only. So I am planning is whatever Riya's decides or Riya starts this year, I want to carry over this because it won't stop with 1 year or 2 years. I think we have to carry forward for years together. So I wish all the very best to this program. Thank you.
Thank you, sir. To invite the speaker, Dr. Priya Velayudhan. We are immensely happy within such a short notice. She was very much ready to do this program for us. Dr. Priya Velayudhan is Assistant Professor Pediatrics at GMC Kozhikode, and she's very much interested and has been taking classes for students, teachers, and counselors for a long period of time. Her special interest is in adolescent pediatrics as well as endocrinology and vaccinology. Welcome, Dr. Priya, for the talk.
Good evening, everybody. Actually, I think right now I'm also going through sort of exam stress because I find that all my teachers, seniors are right ahead of me. And it is a prestige and honor to present before MKC sir, but I'm really scared he will ask me questions. But once sir started talking, I realized that this is going to be a joint effort, and maybe that will set me cool for this talk today. Thank you all. I'll start my presentation. So the topic we have done a few years ago for IAP Kerala for Adolescent Health Academy, and we have uploaded the slides in IAP Kerala downloads. So this is the same slide with minimal correction that I'm using. So dealing with exam stress. So today we will be going through what is exam stress, what is stress, symptoms of exam stress, sources, how to tackle, and a few FAQs. So this is a standard exam hall where you can see a few children are actually actively giving the exams, and a few are anxious about the exams. So we can see that both scenarios happen in the same field, possibly with the same person even. So we are not always not afraid of exams, and we are not always afraid of exams. So what makes the difference? So what is stress? Stress is a physiological response to the unpleasant situation, whichever that is faced by us. So the idea of dealing with exam stress in an average individual must be to make exams not very unpleasant experience. It is more or less that we have to see exams as a pleasant experience. How to equip our children to do it? So first thing is stress always good or bad? Some amount of stress is essential to excellent life, and this is called the good stress or the eustress. So it avoids taking things too lightly, and it pushes us to give us our best performances. But when stress is too much or too prolonged, as in case of the exams currently, it is going through to 3 to 4 months, where there is chronic stress, then it reduces the performance. This type of stress may be distress or the bad stress. So what are the symptoms of exam stress? Generally, we can consider it as cognitive symptoms, emotional symptoms, and physical symptoms. Cognitive symptoms, very common: difficulty concentrating, negative thinking, will I pass, will I get good marks, comparing yourself to others, racing thoughts, blanking out, overthinking. We have all faced a scenario where the answers were just not coming out because of the extreme levels of stress. Emotional symptoms: anger, fear, guilt, feeling helpless, feeling shame and disappointment in our own performances. And physical symptoms: nausea, racing heart, shortness of breath, headache, tense muscles. So these are the usual symptoms in children. What are the sources of exam stress? It is not always that the stress is externally induced. Sometimes it can also be because of the child's expectations or perfectionism. A person who wants to score full marks always may be having a problem. People pleasing: what will others say? What will they think of my results? So that is one of the sources of exam stress. Lack of competence, underprepared or unprepared, or the child is not very equipped in the current field he is trying to compete. Poor time management is one of the biggest sources, and poor learning strategies. The big ones, of course, we have discussed earlier: dyslexia, nonverbal learning disorders, the nutritional problems, substance abuse, physical and mental illnesses, psychosocial traumas the child is going through, and the big group of anxiety, depression, and other psychiatric illnesses. So this module is to prepare those children, the average child who is definitely not going to be diagnosed with these problems in the process they are going through right now. How to tackle? First thing is, we will try to learn about stress. So everybody needs to learn how our stress builders and stress busters are. So what is stress builder for a person? For example, finding a new book in the market may be a boost for somebody who is actually more interested in going through as many new questions as possible, but can be a stress builder for another person. So we all have to identify our own stress builders and stress busters, and much ahead of the exams, of course. We have to develop problem-solving skills. Each of the children going for exams, and as well as adults, have to go through the problem-solving skills. What happens if the first question I see is something I cannot answer? What am I going to do? So this scenario has to be played out in the mind so that it can actually be done at the time we are facing the exams. Assertive communications, going to say yes or no to multiple things going around, and assertive communication in respect of results. First rank കിട്ടില്ലേ എന്ന് ചോദിക്കുമ്പോൾ അതിനുള്ള answer. That also has to be prepared by the children, and it is best or easiest to imitate somebody who successfully handles stress, which is why the parents and the adults have to be a role model to the children, especially in these years. So express yourself positively. That is very important, and communicate what you are going through. So just look at the picture here. What does the picture communicate? It definitely gives us a positive vibe. It gives us memories of good times shared. And this is important to have the good things or the positive cues around us to help the children in good performance in their exams. Now, how to equip the children to a stress-free zone for the exams. So here are a few learning strategies. Ideally, this has to be communicated to them in the beginning of the year so that they can use these strategies as they go through the exams. First, most important point is to listen well in the classroom. Take good notes and to review them in 24 hours. So this is going to be helpful in addition to going through your textbooks in detail. So these are different note-taking techniques, just for examples to convey to the children: semantic maps, cycle chains, Venn diagrams, cause and effect, mind maps. So these are easy note-taking techniques. Even without carrying through multiple books in the class, you can handle this with the information given in a given class with good note-taking techniques. Then they have to schedule the time and study with concentration. For there is a time to eat, there is a time to sleep, there is a time to play, and there is a time to study. This makes a good time schedule. Otherwise, all these things has to be packed in 24 hours for the child. And if the child is transport is taking a lot of the time, that also has to be scheduled in the 24 hours time. So this is very important to convince the children that it is not only the hours of studying that is important, it is also the hours taken for rest and sleep. SQ3R method. So what is SQ3R method? We survey, question, revise, and go through the textbooks multiple times so that with an inquisitive learning experience, so that they can ask themselves the questions. So that helps them in equipping them for the exams. And start revising well before the exams and try to gain good exam taking strategies. And should a child always remain cool? That is obviously not very easy, but we should know how to get ourselves back to the cool zone. So how can we boost memory? The most important thing is revision. There is something known as a forgetting curve, where if you don't revise, we keep forgetting a lot of things. So even we also know that when we are not using a new skill we have acquired in a previous CME, we are going to lose out on using it at the right time. There can be study techniques like mnemonics, flashcard, review cards, semantic maps we have already seen. The other important point to be stressed on is adequate sleep. It improves the functioning of the hippocampus so that whatever is studied is stored into our hippocampus for long-term memory. If we don't use that, that is the time, if sleep is not adequate, what happens is it is stored. The learning is stored in our short-term memory, and then after some time it is lost. So how to improve the concentration skills? Set aside an area in the house which is used just for study. I think even I have children at home, generally their habit is to study in the bedroom and sleep in the bedroom. That is actually something we have to break. The area to be studying should be free of all distractions, and it is better to divide the work into small, easily attainable goals. I will study what is taught today is the easiest to handle. If you have missed on that, I will study one chapter in a week is easiest to handle. It is not that if you have 16 chapters, you have to think about completing all the chapters, because you may not be able to go through the schedule very happily. Try to study at the same time every day as far as you can. And there is something known as the Pomodoro technique, where you try to use small areas for studying, that is small durations. The Pomodoro technique was described for 25 minutes and followed by a short time for relaxation. But several studies have shown that a longer period of 50 minutes at a stretch is also fine, and a break of 10 minutes will refresh the mind after that. So it is not continuous studying for hours together, but small areas, attainable goals, smart goals can be better for students. And instead of associating books with that is picturizing books as a burden, associate books with relaxation and feeling of satisfaction, improving one's knowledge. That is the best way. That is, they can picturize their study time as a positive time, so that it is also considered as a time for relaxation. And difficult subjects, of course, need more focus. So group study can help, peer educators can help, more time, give your best concentration time, developing a good rapport with the specific teachers. All these can be useful for difficult subjects. So again, it is important that the students, while getting into the subject or different subjects they have, tries to learn these subjects in the beginning of the year itself and identifies what is their difficult area. So it is not advisable to relax the whole year, study through the night, and forget answers during the exams. So what are good exam taking strategies? So one day before the exam, many people become the most religious person on earth. But is it what we have to do? We have to see, especially in case of entrance exam, the locations have to be pinpointed. You have to know exactly what time the Uber takes you, because of course the traffic is going to change with the office hours. So the exact location and the nearest point to stay, this should be kept in mind at the right time. Whether you need pen, pencils, or everything or nothing, all these things we have to understand. And quick scan of facts and definitions may be useful, but more important is give yourself a few treats and sleep adequately on the day before the exams, and use some time to calm yourselves down. If the exam is on today, we have already set the location and the things yesterday itself. The hall ticket is ready. Don't forget your breakfast. Dress appropriately for the exams, especially again in the entrance exam milieu. It has to be given adequate importance. And it is very good to have affirmative statements. Standing in front of the mirror and boosting yourself up is a very good tip you can give to any adolescent who is taking the exams. And reach the center early and relax only with what you already know. And don't look at the book which you don't know. During the exam, you can try, if you are getting stressed, you can do the relaxation exercise, box breathing, diaphragm breathing. These are all good techniques. Read the question paper and prioritize and schedule time so that you also leave 10 to 15 minutes for checking. If you don't know the question, skip and move on. Again, for good students especially, this is something which needs prior practice. Learning to skip and move on is difficult unless they practice it well enough before the exams. And after the exams, especially when you have multiple exams scheduled, avoid postmortems. And this is a normal phenomenon that many people will be discussing exams and some people don't want to discuss exam. Normalize it. It is not necessary to discuss with the other students and compare yourself. Practical exams, the appearance and grooming is as important as your performance. Again, affirmative statements can be very important. Relax till your roll number is called, because most of the time waiting for your number actually gets you into more frenzy. So that time can be wisely used to get into relaxation technique. Practice the confidence, how you are going to walk, how you are going to give the eye contact, and how you are going to walk the talk. So what to avoid? Breakfast and dinner are very essential, and the dinner has to be light. And avoid the junks, reduce coffee, and include micronutrients in the diet. So the ICMR recommendations for 24 is here, and we can see that from the 2200 we have studied years ago, you can see that the value for children, that is the growing age, it has gone up to 3300 calories for boys, and it is up to 2500 calories for girls. So it is important to stress on giving this adequate diet to all the children with special focus on iron-rich fruit and seasonal fruits. What about the sleep? How long should we sleep is a very common question, and how to get a good night's sleep is another very common question from the adolescents going through the exam stress. They need a minimum of 8 hours sleep, and we have to inform the parents that delayed sleep-wake pattern actually is a normal phenomenon in children. And this is again a common complaint once a study leave starts, that he sleeps till 11 in the morning. A cool, quiet, and comfortable bedroom with a consistent sleep schedule can be helpful. And avoiding the screen prior to bedtime is very important and should be stressed, because it can affect your sleep habits as well as the sleep quality. Why exercise is important? Aren't you wasting the time which is required to study? Aerobic exercises like walking or cycling, that is 30 minutes to 1 hour per day, is very important for our physical fitness. In addition, they also release endorphins, which are natural stimulants and makes you happy. It is important to equip against, that is a positive factor to tackle stress. So it also increases your enduring capacity and gives you more stamina to work. Yoga is a good exercise as well as a relaxation technique. And quick fix strategies. Once you feel stressed, this stress can come and go in waves during the day. Stretch and laugh hard with your friends. So that is very, very important. Doing good breathing exercises, I think I mentioned earlier, box breathing can be useful. Listening to calm music is very important, and enjoy the sunlight. Walk outside when you are feeling really stressed. Practice shrugging. The shrug is a good exercise which will improve our muscle relaxations, and that is the description given in the textbook is like the emoji of shrug, that those muscles have to be used to relax so that the child can use it for relaxation. And talk less and listen more. The more you talk, especially with your peers, the more it is going to build up stress. Talk about anything other than the exams. And always remember to count your blessings. Why solitude? It is also important for children. As much as the time spent with the books or with the family, you can always compare with yourself. What did I know 1 year ago? Express your stress. Write, talk, journal is a in thing today's. So that may be helpful. Or just sit out and accept the situation and think about it. And then take charge. Believe that I am in charge of my life, and try to gain perspective. That is, where do I stand today? Do I compete with the best? If not, how do I get to compete with the best? So that is very important. Even solitude can be a time to relax. And going through some frequently asked questions. Most of this, as in our counseling sessions, this has to be just addressed and left to the student himself to answer. After giving the facts. What if I do badly? How do I deal with my family's disappointment? I think there is too much pressure and I can't cope. Everyone tells me to concentrate on my studies and do nothing else. Should I study in the morning or evening? Should I exercise during exam time? What if I skip breakfast? Most of these topics we have addressed in this module. So the answers has to come from the children themselves. Examinations are definitely an inherent part of life, and it is a challenge which helps us learn life skills, coping strategies, and develop stress busters for exams and other practices in our life. Thank you.
Thank you. It was actually very informative and also concise. You have conveyed everything. It's a nice module. Now, Riya sir.
I think we can get comments from senior teachers and because I think most of them may have seen children with these issues and we can hear from them also.
I think she has done an excellent job. She has covered almost everything. Only one or two small points maybe. One of the problem is when you sit to study for the exam, all sort of unwanted thoughts come to you. And you struggle to get rid of those thoughts. Don't do that. When you try to remove something from your brain, actually is getting reinforced. Just like if you have to get up in the morning, then what happened? You can never sleep. Okay, so that is one great advantage thing. Second one is what will happen if I fail? Nothing will happen. Nobody is going to, kill you or something. Forget it. And the parents should say, "Okay, you are done well." And the best advertisement I have seen is a child who was offered a special, chocolate if she beat somebody. And when she came, she didn't beat anybody, but she got a chocolate. So I asked the mother, why, mom, you are given the chocolate? He said, you have beaten yourself. Last time you had 65. Now you have 70s. That means you have beaten yourself. So I think such sort of parental talk is extremely. If I tell you from my personal experience, it was just 8 months ago that I gave my last exam. The most difficult exam in my life. 49 modules. And I tell you, it was horrible. Horrible. So whatever the children are going through, I have gone through the same thing. Okay. So that I know it. In our days, what we used to do is as soon as half an hour before the exam, everybody started howling this, that on. We all go together, banging the, this Coca-Cola can and all. The way we are going, the people will think that they are going for picnic. Actually, it's all to get rid of the stress. And as soon as you get the paper, you start crying loud and all that, but now you don't have to do that because there is a cooling off time is given. So you have time. The only other thing to remember is, most often, even at this age, I have missed, 2/3 exam. The one side is all small question. I spent 2 hours for that. The last 1 hour, all essays, I miss it. We can do such stupid things even after having written hundreds of exams. So that we need to tell the students. Now, one other point I would like to say is that now it's a little more serious note. If you really want to treat a bad examination fear, the real bad one with a lot of psychological overlay, the whole literature I have scanned, CBT is the only method that is set. But of course, CBT, cognitive behavior therapy, is not something which we can do often. You need a psychiatrist or clinical psychologist. So what I was saying, is there any method that is proved by? So there is a method proved by randomized controlled trial, and that is called mindful based stress reduction, MBSR, mindful based stress reduction. And what are the steps in that one? Actually, we have some notes on that. One is mindful breathing for 2 to 5 minutes. That means you breathe in for 4 seconds, hold for 4 seconds, and exhale for 6 seconds. So 8 plus 6, 14, something like that. 4-second breathing, 4-second hold it, and exhale for 6 seconds. That is the number one. Number two is body scan meditation. It's like any other meditation we do, focusing on from tip of the toe to like that, go on, like that. It's impossible to do it day before the exam unless you practice it early. The third one is mindful studying. That means when you study, you focus only on one thing. Don't bother about what all questions can come. You just study what you are doing, and on every topic, make sure you know 3 points. This is the most important one. You must have studied everything, but the moment you see the exam, everything you forget. Onnu orkam vayya. So you should know 3 things. Anything in the book, only 3 things you should know. So when you know those 3 things and you start writing, another 6 things or 10 things will come there. So tell the children to focus only on the key things. What if that comes? What if this comes? Like that, anything under the sun can come for the exam. Instead of that, what is the commonly asked one? Try to study three points on everything. And then, of course, the 4th one is acceptance of anxiety. Tell yourself that everybody, that's why I said at this stage, I was so anxious and all that before the exam. So that was also difficult, very difficult exam it was. So what we need to accept that exams are difficult. Only the teacher won't get stressed, but the student who always will get stressed, that is okay. How many exams I have given? It is like, just remember anatomy days. First time you had the weekly exam, you were so stressed, whole night you are studying, still you are stressed. By the time you become the 10th exam, let's go for a movie and come back. No, nothing happens. Then you start going for the exam. And one more important thing you said was, after the exam, don't discuss. One method we used to do was, as soon as the exam is over 12 o'clock, have food and just jump out for the noon show. Go for noon show. By the time you come back, everybody is settled. All the discussion about the exam is over. Then you can quietly lie down for some time and then study for another 6 to 8 hours. So there are lots of simple things. And if the pediatrician can give personal examples, don't try to give big subject. Better, this is the way I studied. I was worse than you. I had so much of this thing. Be very practical. The parents will pretend that they were all great people. You are the only idiot. But the doctor should say that, okay, we all went through the same thing. Nothing to worry. And don't give up. The typical Malayali habit. Even before you start, you give up. Go by the typical Bengal, Punjabi habit. Even if the last ball you can win. Just go till, even if there's only 1 ball left, you said, I am going to win. So that sort of thing, because you may need 6 runs. You have 8 runs to be win. But what will happen is there may be another extra, over you may get, or ball you may get. So never give up. Never give up. I am going to do it. And stop daydreaming about how will I study in the next exam. Most of the time we waste time on that. Because you want to avoid the present thing, so you have to go for the previous. So lot of simple tips can be given to the children. Thank you.
Thank you, sir.
Thank you, sir.
Sir, we'll definitely incorporate these suggestions into our PPT before we
Okay.
release it again. Thank you, sir.
So
Yes,
this
sir.
mindfulness stress thing, can we make a note of something, and if we can upload in the website,
Yeah,
it
it is
will
the
be
same
useful.
thing that is mentioned as box breathing, sir. It is like you inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds, then again hold for 4 seconds. It's like a box.
Okay, so I think that can be a little more explained in the slide, and if you upload, it can, because the pediatrician should know it clearly. Then only we can explain it to other people. Purushottam sir,
Because today I attended this thing to learn something from MKC sir and Priya. I'm not an expert in this area. And one doubt, in fact, sir, about what is your opinion about the pre-exam holidays? We'll be giving study time. What way that will be affecting? Because there are groups, some of these kids who will be enjoying the company, not only for learning, group learning, but the mutual support. So few of them may be alone in when they are left for maybe a few weeks at home. So there should be some level of freedom. Few kids will be enjoying that because there may be multiple members or support. They may be having social platform also enjoying, but few kids may be left alone, and maybe that may add to the stress. So we need to investigate what way the study holidays is affecting their stress.
I think, Purushottam sir, you have raised a very important issue. I will explain it in a very simple way. Now, if you have final examination, before that, before the university exam or board exam, there is a exam conducted by the school. You must encourage these children to look at that as the final exam. Go for a kill for that exam. We all take it lightly. Now, that model exam should be taken as a final exam, because what happens is everybody, good or bad student, last minute thing, if only I had another 6 hours, I would have got it. So that feeling will go away because you get another chance. And model exam is more tough than the actual board exam. That is one point. The second point is making timetable. If you have 10 days study leave, we all believe that, we all say that the study leave is not important, it's not necessary. But we all have given exam. We know that's the time when we sit and cover completely. We cover. Why you need to cover is because then only you feel the confidence. That I have covered everything. Nothing can come like that. So I think it is important. But how you use it, different people use it for them. I had done 14, 15, master's degree. So what I did was mostly it was not for the degree, but to my weight reduction. 15 days, I will be walking up and down in the room and mugging this. And at the end of the 2 weeks, my weight reduction happened. So that means everybody has your own style of learning. So that somebody talk loud, somebody walk on the terrace, somebody do this. Don't criticize any of this. Every child has his own or her own way of learning. And if you have timetable, if you have a long timetable, then you give time for each subject. Suppose you are given 4 days or 5 days for anatomy. That 5 days, you don't think about any other subject. Only think, have I finished what I am supposed to do? Invariably, you won't be able to finish. So you must give 1 or 2 days extra in the end, so that whatever leftover can be done. At least 2 revision you must give time. Because even if you give 1 month, what will happen is you will read all the unwanted things in the book and then waste your time. Instead of that, have a look at the question paper. What are the most commonly asked questions? Can you answer those questions? You check first. And then revise. If I tell you, at least in our time, pharmacology, we had to study the drug classification. Remember? I think, Purushottam, you also must have done that. What do we do? Even when you go to toilet, you have that paper in your hand because you keep on mugging that. Nowadays, that is not required. But what we need to do is, in that small, diary, small one, pocket diary, you must have the points written and revise that points again and again. It is very difficult to open the book and sit and study, but it's easy to do. Even if when you are sitting in the bus, you can actually mentally revise those things. Revision. Somebody may laugh it at as mugging. Somebody may say it is ratifying and whatever nonsense we say. But ultimately, the path has to be cleaned again and again and again. Then only you can remember something in the exam. That will be my idea. Okay.
Thank you, sir. Parvati madam.
Good evening to all. The stress management, it is important for the parents as well, because the children, when they are stressed, the parents also will be stressed, and that stress will be transferred to the children also. And one thing I have noticed is revision. So intelligent children, intelligent students, they don't like revision at all. They once they have studied, they will say, I have studied everything. They are not interested in revision at all. Most of the intelligent students I have seen. And that is one problem about revision. And sir said about reduction in weight. Actually, I put on weight during my SSLC revision holidays. So my teachers were saying, oh, at least Parvati has put on weight. So that's also important. Eat full, nicely. You get enough nutrients And that is also very important. Micronutrients, especially iron and other things, iron containing food items. That's very important. And during this period, hydration also is very, very important. Children, they should take enough fluids. That is very, very important, especially during the hot season. Our exams come during March, April. So it will be very hot. That's also has to be considered. And this box breathing is very nice to relieve stress. And also all this pranayama, at least adolescent children can learn that. And once you get angry, or if the parents ask the child to study, they will be upset, and that there will be a vicious cycle. And for that, the parents also can master this pranayama, and the students also. That's box type breathing is very good. Thank you. Excellent talk, Priya. Excellent talk.
Madam,
Thank
just one comment on your point that good students don't like to revise. We also had many students like this. What we need to do is you just ask him to take one small exam and see how much he reproduce. That I think this word should be, it is not important how much you studied. How much can you reproduce? Because unless you reproduce on the paper, nobody can give you mark. So the good student who refused to do revision, ask him to reproduce, give him a answer sheet, answer checklist or whatever you call it. What do you call that? In the exam, they give this thing, Purushothaman, we give something to the teachers, how to correct it and all that. So give that one, let them correct their own paper. Don't give a whole paper, just write one question, essay, and see how they are done. Then they will realize, although they have studied so much, what they are reproducing is very little. And without reproducing, how can you get mark? That's the point. That's the answer to your suggestion. Okay, madam.
Very good point, sir. I'll see to that.
Thank you. Thank you. Sajumar sir. Unmute ചെയ്യണേ sir.
Thank you. Good evening, my respected teachers, colleagues, and friends. It was a great session, and also the comments by our teachers. I wish we only had such classes during our exam times. I just want to add one point. As we all know, the human brain has enormous capacity. It can store up to about 2.5 million GB of information, which is equivalent to about 300 years of continuous TV shows. Yet the students often forget things. Why does this happen? It's not because our brain lacks storage, but because the information is not organized or it's not stored properly. I'll give you an example. Imagine walking into a library where the books are kept very scattered randomly in an haphazard way. Finding a specific book would be nearly impossible. However, if you walk into a well-organized library where the books are kept according to a cataloging system, retrieving any book becomes very easy. It is almost effortless. Similarly, the way we arrange information in our minds determines how easily we can recall it. So one of the best techniques to improve memory and reduce stress, especially in children, is the use of mind map. Dr. Priya has mentioned, but I am sorry that she only mentioned in one line. The mind maps, these visual tools help in organizing thoughts and connecting ideas very effectively. Recognizing their benefits, mind maps have now been incorporated into the CBSE syllabus. As pediatricians, we should encourage all students to use mind maps for better understanding, better learning, and reducing stress. Thank you. This is the one point I have to make. Thank you, sir. Thank you.
Excellent point.
Sir, Priya, in the module, are we going to implement this thing at the time of examination, or during the early period of classes, we'll be visiting the schools, and there you'll be giving talks on the nutrition, exercise, and many other things. There also, few of these points need to be given in the early talks. During the other subject, especially the time management and few points, rather than everything at the end. Exam time-like vekkade, few of the points should be chosen. The module should be selected in such a manner that few of the points need to be incorporated in the early addressing period. രണ്ടാമത്തെ കാര്യം, we need to address the teachers also for the during this formative examinations, what all things to be implemented at that period. Formative period അകത്തും എക്സാമിൻ്റെ അകത്ത് കുറച്ച് വരുമ്പോഴത്തേക്ക് കമ്പാരിറ്റീവ്ലി ഒന്നുകൂടി റിലാക്സ് ആയിട്ടുള്ള കാര്യങ്ങൾ അതിൻ്റെ ഒരു ലേണിംഗ് സെഷൻ അപ്പോൾ തന്നെ വരുത്താന്നുള്ള കാര്യം.
താങ്ക് യു സർ. ഇത് നമുക്ക് ആക്ച്വലി ഇത് ക്ലാസ് എടുക്കാൻ വേണ്ടിയിട്ട് മാത്രമല്ല, നമ്മുടെ ഇൻഡിവിജ്വൽ പ്രാക്ടീസിൽ വി ഷുഡ് ഓൾ ഡു ദിസ്. അതായത് ഇത് വരുന്ന ഒരു കുട്ടിയോട് പഠിത്തമൊക്കെ എങ്ങനെയുണ്ട് എന്ന് പീഡിയാട്രിഷ്യൻ ചോദിക്കുകയാണെന്നുണ്ടെങ്കിൽ ദി പേരന്റ് ആൻഡ് ദി ചൈൽഡ് വിൽ ഡൈവൾജ് ദാറ്റ് ദർ ആർ ഇഷ്യൂസ്. ദെൻ വി ഗെറ്റ് ആൻ ഓപ്പർച്യൂണിറ്റി ടു ഇന്റർവീൻ. കാരണം ആ ഒരു രീതിയിൽ പോകണമെന്ന് എനിക്ക് തോന്നുന്നു. കാരണം ഇതൊരു ഇപ്പോൾ ഒരു യുബിക്വിറ്റസ് ആയിട്ടുള്ള ഒരു പ്രോബ്ലമാണ്. ഇതിപ്പം നേരത്തെ മാഡം പറഞ്ഞതുപോലെ സംടൈംസ് ദി പേരൻസ് ഗെറ്റ് സ്ട്രെസ്ഡ് മോർ ദാൻ ദി ചൈൽഡ്. അതാണ് ഒരു മെയിൻ പ്രോബ്ലം.
പുരുഷോത്തം സാർ, നമുക്കിതൊരു ഫയർ ഫൈറ്റിംഗ് ആയിട്ട് ചെയ്യാൻ പറ്റൂ. പോയിന്റ് ഈസ്, ഇപ്പൊ നമുക്കിതൊരു ഫയർ ഫൈറ്റിംഗ് ആയിട്ട് ചെയ്യാൻ പറ്റത്തുള്ളൂ. ഇത് സിസ്റ്റമാറ്റിക് ചെയ്യണമെങ്കിൽ യു മേ നീഡ് ഹോൾ ഇയർ. അന്നേരം പ്രോബ്ലം എന്താന്ന് വെച്ചാൽ വി മേ നോട്ട് ബി സോ മോട്ടിവേറ്റഡ് ആൻഡ് സ്റ്റുഡൻസ് വിൽ നോട്ട് ബി മോട്ടിവേറ്റഡ് അറ്റ് ഓൾ. വെറാസ് when it's in a firefighting mode, it may not be 100% effective, but at least 50% effective, because they are too much in need of some help. And plus, your number will be available to the student, so that even if you are not the best expert with so many years of counseling experience of children you have done, you could give simple tips. What comes to your common sense mind, that is enough. We just tell them that there are so many pediatricians who are willing to help you. Your number is available with that smaller group. You have a real problem, call me, so that even if I can't solve it, I know who to refer to. That's the idea.
Okay,
Sir, actually, when we started this module, we were planning to do it in the beginning of the 11th standard. Actually, that was the idea. But since this is March, we have actually left out a few slides. It was for us to, the slide was arranged in such a way that for somebody who has done well in 10th standard and somebody who has not done well in 10th standard, what are the methods to be adopted? But since this is the end of the year, it doesn't seem very relevant. So we have put out some slides from the presentation.
Yes, റിലീജിയസ് സാധനങ്ങൾ ഇപ്പം SSLC എക്സാമിനേഷൻ വരുന്നു, നോമ്പുള്ള സമയത്ത്, ഇത്രയും ഹോട്ടായ സമയത്ത്, is there any provision for taking water? അത് റിലീജിയസിന്റെ അതിൽ ടോട്ടലി അഗൻസ്റ്റ് ആണോ? അതൊരു പോയിന്റ് ടു ബി ഡിസ്കസ്ഡ് among the religious leaders. പറ്റുമോ?
അത് ആക്ച്വലി എങ്ങനെയാന്ന് വെച്ചാല് ഇപ്പം നമുക്ക് ഹലോ കേൾക്കാമോ സാർ?
കേൾക്കാം.
ഹലോ
കേൾക്കാം.
എനിക്കൊന്ന് നെറ്റ്വർക്ക് ഇഷ്യൂ. ആക്ച്വലി സാറേ, ഇപ്പോൾ ഈ നൊയമ്പ് നമ്മൾ ഈ പ്രിസ്ക്രൈബ്ഡ് ഡേയ്സിലാണെങ്കിൽ പോലും നമുക്കൊരു റീസൺ ഉണ്ടെങ്കിൽ, ഇപ്പം സുഖമില്ല, അപ്പം അതുപോലെ പരീക്ഷയാണ് അല്ലെങ്കിൽ യാത്രയിലാണ്, അങ്ങനെയൊക്കെ എങ്കിൽ വേറെ ദിവസങ്ങളിൽ എടുക്കാൻ ഒരു പ്രൊവിഷൻ ഉണ്ട്. ആക്ച്വലി ചിൽഡ്രൻ ക്യാൻ ഡൂ ദാറ്റ്. അപ്പോൾ അത് റിലീജിയസ് ബിലീഫിനോ ഇതിനോ ഒന്നും എതിരല്ല. ദേ ക്യാൻ ആക്ച്വലി വേറെ ദിവസങ്ങളിൽ ഫാസ്റ്റ് ചെയ്യാം. അങ്ങനെയാണ് അതിൻ്റെ ഒരു. രഞ്ജിത്ത് ഒന്ന് പറയോ? രഞ്ജിത്ത് ഇങ്ങനെ സ്ഥിരമായി എക്സാം ഫിയർ, ഇപ്പൊ അടുത്ത സമയത്ത് രഞ്ജിത്ത് ഒരു ക്ലാസ് ഒക്കെ എടുത്തതേ ഉള്ളൂ. രഞ്ജിത്തിന്റെ ഒരു എക്സ്പീരിയൻസ്.
ഗുഡ് ഈവനിങ്. എല്ലാ തവണയും നമ്മളോട് ചോദിക്കാറുള്ള ഒരു കാര്യമാണ് സാറേ, പിന്നെ ഇതില് നമ്മുടെ എങ്ങനെ ബൂസ്റ്റ് മെമ്മറി ബൂസ്റ്റ് ചെയ്യാൻ പറ്റുന്നത്, റിലാക്സേഷൻ ടെക്നിക്സ് എപ്പോഴും ചോദിക്കാറുണ്ട്. പക്ഷെ ഞാൻ മനസ്സിലാക്കിയത് സാധാരണ നമ്മൾ ഈ മൊഡ്യൂളിലെ പോലെ തന്നെ നമ്മൾ ആ റിലാക്സേഷനും അതുപോലെ പിക്ചറുകൾ വെച്ച് നോക്കാനും അതുപോലെ തന്നെ നമ്മൾ ആ മൈൻഡ് മാപ്പുകൾ അങ്ങനത്തെ കാര്യങ്ങളാണ് നമ്മൾ പറയാറുള്ളത്. പക്ഷെ സാറ് ഇപ്പൊ പുരുഷോത്തം സാറ് ഡിസ്കസ് ചെയ്ത മാതിരി നമുക്ക് കൂടുതൽ അവർ റിസപ്റ്റീവ് ആയിരിക്കുന്ന ഈ ഒരു സമയത്താണ്. നമ്മൾ ഇനീഷ്യൽ ടൈമിൽ പോകുമ്പോൾ അത് അത്രയ്ക്ക് അവർ ആ ക്ലാസ്സുകൾക്ക് അത്ര റിസപ്റ്റീവ് ആയിരിക്കില്ല. അപ്പൊ നമ്മളിപ്പോൾ ഞാൻ റീസെന്റ് ഭവൻസിൽ പോയപ്പോൾ അവർക്ക് ആ സമയത്ത് ഈ കാര്യങ്ങൾ കൂടുതൽ അറിയാൻ താല്പര്യമുണ്ട്. മറ്റേ നമ്മളത് പറയുമ്പോൾ നമ്മളൊരു എയറിലൂടെ പറഞ്ഞു പോകുന്ന ഒരു ഫീലിംഗ് ആണ് അവർക്ക് ഉണ്ടാവാറുള്ളത് യൂഷ്വലി. ഇപ്പൊ എന്ന് വെച്ചാൽ ഇവരുടെ ഒരു സാറ് കെ സാർ പറഞ്ഞു, ഇപ്പൊ അവരുടെ ഒരു ആവശ്യമായി ചോദിക്കുന്ന സമയങ്ങളിൽ നമ്മൾ പോയിരുന്ന സമയത്ത് അവർ കൂടുതൽ റിസപ്റ്റീവ് ആണ് ആ ചോദ്യങ്ങൾ. അപ്പൊ ഞാൻ ലാസ്റ്റ് ചെയ്ത ഒരു റേഡിയോ ടോക്ക് ആണ്. അപ്പൊ അവർ ഈ ക്വസ്റ്റ്യൻസ് ആണ് കൂടുതലും ചോദിച്ചത്. എങ്ങനെ മെമ്മറി ബൂസ്റ്റ് ചെയ്യാൻ പറ്റും, അല്ലെങ്കിൽ എങ്ങനെ ഓർക്കാൻ പറ്റും, എങ്ങനെ റിലാക്സ് ചെയ്യാൻ പറ്റും, ആ ടെക്നിക്കുകളാണ് ചോദിക്കുക. അപ്പൊ എനിക്ക് തോന്നുന്നു നമ്മൾ യൂട്ടിലൈസ് ചെയ്യാൻ പറ്റുന്ന ഏറ്റവും അവസരങ്ങൾ ഈ ടോക്കിനൊക്കെ പറ്റുന്നത് ഒരു ഫെബ്രുവരി ടൈം ആയിരിക്കണം. ഫെബ്രുവരി ഇപ്പൊ നമ്മൾ ഇതിപ്പോ കുറച്ച് മാർച്ചായി, പിന്നെ എൻട്രൻസ് കുട്ടികൾക്കൊക്കെ ആണെങ്കിൽ നമുക്ക് കുറച്ചും കൂടെ നമുക്കൊരു മാർച്ച് ഏപ്രിൽ നമുക്ക് യൂട്ടിലൈസ് ചെയ്യാൻ പറ്റുന്ന തോന്നുന്നു. നമ്മൾ അന്ന് ഈ മൊഡ്യൂൾ ഉണ്ടാക്കിയത് 2023 ജോസ് സാറിന്റെ പ്രസന്റേഷൻ പീരീഡിലായിരുന്നു. അപ്പൊ നമ്മൾ അത് പ്ലാൻ ചെയ്തത് അതിനനുസരിച്ചിട്ട് നമ്മൾ ചെയ്യാമെന്നുള്ളതായിരുന്നു അന്ന് ചെയ്തത്. അപ്പൊ ഇനി നമുക്കത് കുറച്ചും കൂടെ സിംപ്ലിഫൈ ചെയ്യാം. ഈ ഇൻപുട്സുകൾ എടുത്ത് നമുക്ക് ഒന്നുകൂടെ വേണമെങ്കിൽ മലയാളത്തിലേക്ക് ആക്കണമെങ്കിൽ ആക്കാം, അല്ലെങ്കിൽ നമ്മൾ ഈ മൊഡ്യൂൾസ് നമുക്കൊരു ഇപ്പൊ നമ്മളിപ്പോൾ ഇതിൽ ഇത്രയും ആളുകൾ കേട്ടു, അപ്പൊ അത് വേണമെങ്കിൽ ഒരു റിസോഴ്സ് ഗ്രൂപ്പുകൾ പല ഡിസ്ട്രിക്റ്റുകളിലും ആക്കി നമുക്കത് മുന്നോട്ട് പോയാൽ ആളുകളിലേക്ക് എത്തിക്കാൻ കുറച്ചുകൂടി എളുപ്പമായിരിക്കും സാറേ.
താങ്ക് യു. സോ നമുക്ക് ഓൾമോസ്റ്റ് 10 o'clock ആയി. അപ്പം
റിയാസ് ഒരു കാര്യം നമ്മൾ SSLCയോ +2 അല്ല കുട്ടികളെ സംബന്ധിച്ചുള്ള ഏറ്റവും സ്ട്രെസ്ഫുൾ. കാരണം അവിടെ ഇപ്പൊ ജയിച്ചാൽ മതി, വലിയ കുഴപ്പമൊന്നും വരത്തില്ല. ക്ലാസ് കിട്ടിയില്ലെന്ന് വെച്ച് കുഴപ്പമില്ല. പക്ഷെ എൻട്രൻസ് അങ്ങനല്ല, ഡു ഓർ ഡൈ എന്നുള്ളതാണ് അവരെ സംബന്ധിച്ചുള്ള ഡു ഓർ ഡൈ. അതുകൊണ്ട് നമ്മൾ ലേറ്റ് അല്ല. നമ്മൾ തിയറട്ടിക്കലി ലേറ്റ് എന്ന് പറഞ്ഞാലും വി ആർ നോട്ട് റിയലി ലേറ്റ്. ഈ +2 പരീക്ഷ കഴിഞ്ഞുള്ള എൻട്രൻസ് പ്രിപ്പറേഷൻ ടൈമിലാണ് നമ്മുടെ ഫുൾ സ്വിങ് ആവശ്യമുള്ളത്. എൻട്രൻസ് എന്ന് പറയുന്നത് ശരിക്കും ഡു ഓർ ഡൈ ആണ്. അവര് എന്തും ചെയ്യുന്ന സമയമാണ്. സോ ഐ തിങ്ക് വി ഹാവ് നോട്ട് ലോസ്റ്റ് ടൈം, വി ആർ ഇൻ ദ റൈറ്റ് ടൈം എന്ന് ഞാൻ പറയും.
ഓക്കെ സർ.
Thank you, sir. Now I invite Gobi Mohan sir, IAP Kerala Secretary, for the vote of thanks.
Hello.
കേൾക്കാം, പറഞ്ഞോളൂ ഗോപി.
Yeah, okay. Respected MKC sir, Honorable Riyas, other dignitaries, seniors, and my friends. To start with, I must really thank MKC sir for being here. It was a very good interaction. And when we first started a brainstorming session, it was sir who recommended us to have a session on exam stress. And it was a very valuable suggestion, sir. And your inputs are very helpful for us. Thank you very much, sir. And I should thank Riyas also, who took up this project in a very short short notice, I should say. And I thank Deepa and all the AHA office bearers who came forward to organize this webinar. Thank you, Priya. That was a very informative but crisp talk on exam stress. Thank you, Parvati Madam, Shaji sir, and Ranjit for your valuable inputs, and Purushottam sir also. I'd like to thank Nandakumar sir, other dignitaries, seniors, and my colleagues. And we hope that we'll follow it up in other schools also. Thank you very much. Jai Hind and Jai IAP. Good night.
Thank you. Thank you, sir. Good night.
Thank you.
അടുത്ത മീറ്റിംഗ് എന്നാണ് തീരുമാനിച്ചോ റിയാസ്?
സാറേ, നമ്മുടെ ആ സെഷൻ ഏപ്രിൽ ഫസ്റ്റ് വീക്കിൽ തന്നെ ചെയ്താലോ എന്ന് വിചാരിക്കുന്നു. മീറ്റിംഗ്
ലേറ്റ് ആക്കണ്ട.
ഇല്ല, നമുക്കൊരു 2 ദിവസത്തിനാണ് ഞാൻ ഡേറ്റ് ഫിക്സ് ചെയ്ത സാറിനോട് പറയാം.
ഓക്കെ. Good night, everybody.
Good night, sir.
Thank you, sir. Good night.